Hello friends, if you have not watched the part 1 for exam recall on pharmacology regarding the INI CET exam, then watch it, and the link for that is in the description box. And this is the part 2 for exam recall pharmacology sessions. Remember, these questions are based on the recall of students, so there might be some change in the options based on the recall of the candidates. If you are coming to my channel for the first time, then first subscribe my channel. This graph is showing what? Zero order kinetic, first order kinetic, non-linear relationship, no relationship can be established. So answer here is a first order kinetic. So here you can see in the graph, on x-axis there is a time and on the y-axis there is a concentration. So this is a first order kinetic. A pharmacologist is evaluating newly developed drug in an animal model. From the below graph, what is the therapeutic index of this drug? So here you can see the ED50 400 and LD50, that is 100. Okay, ED50 and LD50 are given. So if you apply the formula of LD50 upon ED50, you will get 4 as the answer. So the correct answer is a 4. So this question was there about match the following, and you have to match with the correct option. Here I have just given the correct answer. What is the correct answer for each option? Spermidine, histone acetyl transferase, EP300. Metformin is for AMPK activation, inhibits the mTOR pathway. Resveratrol, SERT1, AMPK pathway. Rapamycin inhibits mTOR pathway. Another match the following type of the question: opioid overdose, naloxone, delirium tremens, oxazepam, alcohol de-addiction, acamprosate, and smoking cessation, varenicline. These are the correct options for this question. Now, patient presented to emergency department with the bradycardia, hypotension, sweating, and pinpoint pupil. Which of the following drug act by binding to acetylcholine esterase? Pralidoxime, atropine, naloxone, and flumazenil. So this was very easy question. Which of the following drug act by binding to acetylcholine esterase? So pralidoxime acts by reversing the acetylcholine esterase enzyme. So answer here will be pralidoxime. Now patient presented with the respiratory depression, pinpoint pupil, and unconsciousness. Which drug is antidote? Options are fomepizole, atropine, naloxone, and flumazenil. Now here this is a classical case of opioid poisoning. For opioid poisoning, the antidote is naloxone. Which statement is correct regarding nicotine replacement therapy? Nicotine gum is more effective than lozenges. This option is not correct. Coffee soda should be avoided 15 minutes before nicotine gum for maximum oral absorption. This is the right option. Varenicline comes with black box warning of cardiovascular side effects. This is not true. Preferably given by gastrointestinal route. So this is also not true. So here the answer is coffee soda should be avoided 15 minutes before nicotine gum for maximum oral absorption. So for maximum absorption of the nicotine, you have to advise to the patient that you take coffee or soda either 15 minutes before or 15 minutes after the nicotine. Drugs like latanoprost lower intraocular pressure by promoting aqueous humor drainage through which physiological pathway? Trabecular meshwork pathway, uveoscleral outflow pathway, blocking carbonic anhydrase pathway through canal of Schlemm. Answer here is a uveoscleral outflow pathway. Very easy question. Which of the following drug is not used in the treatment of mucormycosis? Voriconazole, posaconazole, L-amphotericin B, isavuconazole. Here the question is not used. Okay, posaconazole, L-amphotericin B, isavuconazole, these are used in the mucormycosis post-COVID. Voriconazole is used only in the aspergillosis. So answer here is a voriconazole. Stimulant purgative is contraindicated in which of the following conditions? Spastic paralysis, so that is the right option. Paralytic ileus, opioid-induced constipation, and post-operative. Here the right answer is spastic paralysis. Regarding the hemodynamic effects of halothane anesthesia, which of the following statements are correct? Halothane causes direct myocardial depression, reducing cardiac output. Yes, this is true. Blood pressure initially falls after induction and subsequently plateaus at lower level. This is also true. Blood pressure progressively decreases throughout the surgery irrespective of the anesthetic depth. This is not true. Halothane increases myocardial sensitivity to catecholamines, increasing arrhythmia risk. This is also correct option. So here the answer is 1, 2 and 4. Three options are correct here, 1, 2 and 4. A 45-year-old woman underwent surgery for a parotid swelling under general anesthesia. 10 minutes after induction, she developed rapid rise in and tidal carbon dioxide, raised body temperature, tachycardia, and hypertension. What is the most likely diagnosis? Malignant hyperthermia. Yes, this is the case of malignant hyperthermia. You can see the temperature is raised, right? And this happened after general anesthesia. So classical case of malignant hyperthermia. Heat stroke, no, it is not a case of heat stroke. Heat exhaustion is also not a correct option. Neuroleptic malignant syndrome, that is also not true option. So this is very easy question. Answer is malignant hyperthermia. Which of the following drug does not typically cause respiratory paralysis, depression in overdose? Phenobarbital, opioids, thiopentone, and ketamine. So respiratory paralysis in overdose is not caused by ketamine. It is very safe drug. So answer is D, ketamine. A 7-year child presents with the multiple scaly patches over the scalp associated with itching and patchy hair loss for 3 weeks. On examination, it reveals well-defined scaly lesions with the broken hair, suggestive of tinea capitis. This was the image-based question. What is the most appropriate treatment? Oral antifungal therapy. Yes, this is tinea capitis and you have to give oral antifungal drug. Oral antibiotic therapy is not a true. Methotrexate is again not true. Topical corticosteroids is also having no role. So here the answer is oral antifungal therapy. So this completes your pharmacology recall session on INI CET exam. So from this recall session, you have to learn what are your mistakes. Most of the students have categorized this May 2026 INI CET exam paper as a moderate to difficult type, but these all depends on the preparation. So you have to master the skill of managing the time during the exam. You have to remain calm, and at the same time accuracy plays important role rather than attempting more number of questions in the INICET exam. So you have to focus on your preparation. If you are well prepared and you are confident about all the subject, then you can easily get the good rank in the exam. If you like this video, subscribe my channel and follow for more pharmacology related videos. Thank you for watching.